Hello, everyone. I am Theresa Betancourt. I'm here to talk about my book, Shadows into Light, which came out in January. I wrote this book because I am motivated by the fact that in our lifetimes, we are facing the largest humanitarian crisis since World War II. It's now estimated that 1 in 6 children around the world lives in an active conflict zone. If you come to post-conflict settings like Rwanda, post-genocide Rwanda, post-conflict Sierra Leone that the book is about, that number swells even further. We're talking about 473 million children growing up in conflict zones. So as a researcher in public health and child development and mental health and trauma, after a while, I realized that publishing research articles one at a time, disjointed, was no longer able to tell the story that I shared in this book. And the story that I shared in this book is the story of a 23-year journey with colleagues in Sierra Leone after the end of an 11-year civil war, which raged from 1991 to 2002, where we had the massive abduction of children into armed forces and armed groups. You've probably heard the term child soldiers. Sometimes that is a misnomer because it's giving the image of a boy with a gun. That's not the truth. When we look at every conflict around the world where children are involved, it's girls as well as boys. They're involved as cooks, porters, sexual slaves. They're sent to the front lines. But the question was, we don't really know what happens to them after these experiences. We have a lot of cross-sectional research of the mental health impact of armed conflict on children, but we don't have enough developmental longitudinal research. That was the gap that we were trying to fill. So in 2002, we started a mixed method study with my colleagues in Sierra Leone. We had data collection, qualitative in-depth interviews. We also had surveys conducted 2002, 2004, 2008, 2016, slowed by Ebola. And then underway now in 2025, as these young people, 529 of them, a third female, they've become young adults. They've started their own families. They're having their own children. It's become an intergenerational study of war. And one of the most important messages of the book is that this is not a lost generation. A lot of times people would say, well, kids who've been through that level of extreme trauma, if you look at our sample, our children in the sample were taken on average at age 10, socialized by armed groups for 4 years on average. You would think, well, how can you come out of that? The truth is the tendency in our data, 66% of the young people, when they came home, they were met with support from their families and acceptance from their communities. Another 24% of our 529 young people struggled at first, but eventually were able to right themselves and have, in many ways look like their peers in their communities around Sierra Leone today. There is a subset, 10%, that have much higher rates of involvement with police, suicidal attempts and ideation, who struggle to this day. And I tell the story of the social ecology around the child and how important that is. Yes, it's individual perseverance, intelligence, ambition, effort, mental health, and functioning, but it's also who's around you in your family. Who are your supports? What's the nature of family functioning? How about community? Can you get back into school? Can you pursue a livelihood? And what's going on in terms of governance, leadership on these issues of health system strengthening, of opening opportunities for war-affected youth? And I wrap my story around 2 individuals. They appear time and time again through the different chapters of the journey of this 23-year study. One is the boy Sar. I'll tell you a little bit about Sar. When he was first abducted, he was with his grandmother as a toddler. He was taken from her arms by an armed group to be the houseboy to help a formerly abducted young woman around the house who was being forced to have the children of a rebel commander as a helper. Sar was exposed to countless traumas, sent to the front line, forced to take drugs to inure him to the violence. He was so small when he was abducted that no one knew what he would look like as a teenager. So when family tracing happened, and this was common with the non-governmental organizations, they couldn't identify Sar because they didn't know what he would look like as a teenager. But he had a mother and a grandmother who loved him dearly, wanted him home, but he also had an uncle who rejected him, saw him as stigmatizing, shameful for the family, and this uncle did not protect Sar. So as Sar began to be in the community, he had a lot of community challenges. Now, one thing that had helped Sar at the interim care centers where the young people would come after the war before they would trace their families was he had ridden bicycles to soothe himself. It helped him calm calm his emotions. When he went home, his family didn't have a bicycle. So he would go to the community, and they had bike lenders. You were supposed to pay them. He couldn't pay. He'd take the bike. He couldn't pay. So these people would beat him. His mother had to break up fights, saying they were correcting his behavior. She couldn't understand why someone would do this. And the powerful family leader, his uncle, did not defend him. So you can imagine where Sar's story goes from here. When we last interviewed him, he had been working on a farm. He dropped out of school because he'd pulled a knife on one of these occasions, and he was living in isolation on a farm just for room and board. Moses Zambo, who wrote the foreword to the book, it was my main interviewer of the males in the study, and I could see his face when he entered the room. He had just found out that Sar had died at 24. Now, there's another tendency in this book, which is one of resilience and perseverance, personal growth, and overcoming. And that is the story of Isatu. Isatu was abducted from school when she was sitting for her exams, her grade completion exam. She was only 12. And the Revolutionary United Front rebels took her. Her sister was also abducted. When they got back to the RUF encampment, she saw her sister. And these two girls ran interference for one another throughout the years. They protected each other from sexual violence. And when they came back out of their years with the rebels, they were able to be placed into foster care. And normally foster care situations, people don't have a lot of resources, and they wouldn't invest them in a foster kid. But this kid had such drive. She just wanted to get back into school and continue her studies, and people saw that. So the foster parents, despite not having the money, they leave the power generator on late at night so she could study. She eventually was getting top test scores, wanted to go to pre-medicine programs, but she couldn't afford it. So people passed the hat, and UNICEF even chipped in, the staff at the UNICEF office, to send her to pre-medical classes. She eventually got a scholarship and studied in Latin America. She's now become one of the few doctors in Sierra Leone. So I hope that you'll join us on this journey. I think it's a journey of overcoming hope and perseverance, and thank you so much for your time today.